Hello everyone, and welcome back to another episode of The Mountains We Climb. This is a series where we dive into people's journeys of overcoming challenges and adversity in their lives so that we can understand what is really possible and what it really takes. I'm your host, Jordan Kilpatrick-Smith, and in this week's episode, we'll be joined by Dr. Kristin Wright and explore her journey of starting a career in medicine. Kristin is a first-year internal medicine resident in Kingston, Ontario, where she treats patients admitted to the hospital for diseases of just about every organ, including the heart, kidneys, and lungs. We will be discussing everything from undergrad to the first months of being a doctor, the ups, downs, and sleepless nights in between. Kristin, thanks for being here.
Hey man, thanks for having me.
So where does your story start? Where does this journey of yours begin?
Boy, well, it all started on a cloudy day, July 5th, 1996. A star was born. Just kidding.
I love that. That's awesome.
What do you mean? Do you mean in terms of when I sort of decided I wanted to go into medicine or?
Yeah. So when did you first be like, okay, you know what? I want to go and be a doctor.
Well, I think going through high school, I always really knew that, I was always kind of a nerd and I loved sciences. I loved biology. I just remember always thinking of how cool it was and interesting it was, the way that anatomy just explained everything about the human body. And then there was the other corny classic thing that you always hear about, I just want to help people. And I mean that genuinely, and I did mean that genuinely, but I think a lot of the times, I always knew that I was interested in medicine and I liked it, but it just always felt so foreign to me. There's nobody in my family really in the healthcare field other than a couple of nurses in the family. But no one, I never really had any mentors to look up to in terms of doctors that I knew. So I never really considered it until I'd say probably there's this one high school trip I went on to Nicaragua, and it was one one of those trips that young people can go on, and you do a little bit of volunteering and you see the beautiful country and all that stuff. And so we brought a lot of donations and we were giving them out, and I just remember thinking to myself, we're able to give these people shirts and fruit and stuff like that, but then you just hear their stories about how they're so sick and they can't afford medications. And first, I just remember being really drawn to that and just thinking wow, that's a way to really help people, is to focus on their health. And that's what people really care about, is being healthy. And I guess that just kind of started a passion. And then I started to think about it more and more and more. And I started to be that's what I want to do. And then you start making the plan of how to go through with it.
Yeah. Giving people the gift of health. What an amazing thing to give. You were in high school at this point, right? So you come back from your trip, and then what was that like for you? What was that like?
Well, it was kind of thinking, so I said, for me, I didn't really ever know anybody in medicine. I had no idea how to even go about doing that. You always hear about doctors going through 8-10 years of training after high school, and you always think, oh my gosh, who would ever want to do that? And then I started realizing, hey, I want to do that. I want to do that for 10 years. Mm-hmm. So I actually have to give a lot of credit to my mom and my dad. They were, even though they also knew nothing about the medical field or how to get there, they're so for education, for supporting my brother and I and what our dreams were. And so they literally reached out to their one remote doctor contact and was hey, can my daughter come talk to you about being a doctor and how she can do that? And they're yeah, sure. And so, yeah, it was really nice. They just sat down with me and sort of outlined the process. And from there, it was honestly more of believing I can do this, and then start working towards it and start planning towards it. But you have to make that initial commitment to going after what you want.
Yeah. How did you make that commitment?
You just got to jump. That's honestly, for me, it's not so much a commitment as in, okay, this is what I'm going to do, and there's no flexibility, and if I change my mind, too bad. But I think it was more just giving myself the permission to think that I could do it and to start working towards it little by little.
Yeah, I love that you brought that up because that is such an important point, right? We do have to give ourselves permission to go for it, to chase the dream, to
Yeah, for sure.
ourselves.
And it's scary.
Yeah. How did you deal with that fear?
Honestly, and I know it sounds corny, but support. Like I said, I'm so lucky that my mom and my dad were like my biggest cheerleaders. And I remember calling them one night when I was in undergrad. I think it was first year, and I had done badly on like my first course ever. Like I think I got a 70 something in one of my biology courses on a test, and I called them and I was like, I'm not gonna get into medical school. This is gonna ruin my life.
Yeah.
And they're like, Kristin, like calm down. Like you're doing great. It's okay. Stop comparing yourself to everybody around you. Like get a good night's sleep tonight and go again at it tomorrow.
Nice.
I did.
I think that really highlights the amount of pressure that there is in the university community with if you're going to med school. There is immense amounts of pressure on how well you perform, right?
Oh, for sure. And I did my undergrad in health sciences at McMaster, which is like, as you know, as lots of people here, like one of those classic like pre-med programs. And so I found it really shocking, actually. I grew up in like Brockville, which is relatively small, and like nobody that I knew was interested in medicine at all. And so when I got to university and I was surrounded by all these people who came from families connected and like families of doctors and like legacies, and everybody sort of like had their plan and was like gung-ho for it. Like you can't help but feel insecure and compare yourself and feel like an imposter, kind of.
Yeah. And did that hit you? I guess how early did that hit you?
Honestly, like day one. Yeah, like I remember being in a group and everybody was talking about like all the clubs they were planning to join or start, or like interest groups. And I was like, man, you gotta try this hard. What the heck?
Yeah. For anyone who isn't familiar with this process, I think this is going to be incredibly eye-opening for them to hear about what actually goes into it, because this is a huge accomplishment that you've done. So I'm really looking forward to hearing all of this story. So, okay, you go to university, you're surrounded by all of these people who are the top of the top overachievers, right? You need like,
sometimes, yeah.
You need like, what were the requirements to get in to the McMaster program?
Well, like you had to have a good GPA, and that's not to say that you had to be like no mistakes ever, like whatsoever. Like I can attest to that myself. But like relatively, like you obviously had to do well in school. It's kind of hard to get away from that. For McMaster, I don't think they looked as much at your extracurricular stuff, but I know a lot of the other med schools, like they really, really focus on your CV and sort of what you've documented as making you a whole person, whether or not that's true or not, whether or not what's on your CV actually makes you a whole person or not. So there's that. Research, obviously. Yeah, if you've done other degrees, stuff like that.
Yeah. To get into your undergrad, what were you needing?
What do you mean, like in terms of grades?
Yeah.
I think my GPA was a 3.94 on a 4-point scale. But I don't think that it had to be that high. I think it could be less than that, a little bit less. I also, I got in after third year actually, so I think it was a little bit different. Like I think if you were coming from 4 years, it might have been a little bit less as well, but I was certainly a little bit at a disadvantage because of the 3 years. But I was also like incredibly fortunate to be able to do that after 3 years.
Yeah. So, okay, so first year you enter McMaster. You're in this health sci program. Immediately you start feeling like an imposter.
Pretty much. But I think the key to getting over that was developing a really, really good group of friends.
Yeah. And how does someone go about doing that?
Honestly, maybe I shouldn't be saying this, but in my undergrad program, I feel like because I felt like kind of this imposter syndrome, or even just, I always felt a little bit more relaxed than a lot of the people around me. maybe, what am I saying? I think what I'm trying to get at is that I sort of just latched on to the people who I felt were on the same wavelength as me. I feel like my program was very competitive in a lot of ways. I feel like a lot of people were always looking over each other's shoulders. Everybody's goal was, and not everybody, I shouldn't say that, but many people's goal was to get into med school. And so I just felt it was difficult sometimes, like feeling comfortable with people. And so I was really, really fortunate to like find like 4 or 5 people that I just felt like were kind of relaxed like me. Like I didn't feel competitive with them. Like I'd tell them straight up if I didn't do well on a test, or if I had no idea what I was doing with their project, or, you know, all those like fears and insecurities that come about. And I feel like that's where I really like stayed well, and just that support.
Yeah. And so I think that this is an important point, because at any point in our lives, we can find ourselves without that support, right?
Yeah.
And it's super important. And what I was hearing you say there is that you found a group of people that you could just be you with. You didn't have to put all these guards in. Yeah. Is there like any really big challenge points that stood out to you in your undergrad? Like anything that's like, oh my God, I remember this one time where whatever happened?
I think that was when I first started drinking coffee, because that was when I first started doing sleepless nights. Like that's when I first started pulling all-nighters. And that's certainly not unique to any one particular undergrad program whatsoever. Like we all, I'm sure, have done all-nighters and have all worked really hard towards a goal. I'd say overall, and it's not just one particular event, but you know, coming from high school, like again, a small town, a smaller high school, I hadn't really struggled that much, and I hadn't really been knocked off of my academic, you know, pedestal that much. I'd always done very well in classes, and it wasn't really until I got to university and undergrad where, you know, I'm now in this class of like all these incredible high achieving people, and you just start to feel like a small fish in a big pond, you know? I'd say that was like and I think a lot of people have that experience as well. You know, you just, you like don't do as well as you did in high school, and you start to feel the pressure creep up a bit.
Yeah. Yeah. Okay. So what was getting into med school like? It
was pretty like surreal. It was definitely like a dream come true. And I still am very, very thankful. I'm very, very thankful. It's, you know, what I've always wanted to do. It was literally my dream. I remember calling my parents. So they send you the email at 8 a.m. and I was starting at my like job that day, my first day at my summer job. And so I deleted my mail app off of my phone. I turned off my Wi-Fi. Like I didn't want to know, because I wasn't expecting to get in after third year at all. Yeah. And I didn't check it until 7 that night because I was so nervous.
Yeah.
And then I remember like calling my parents, and they were at the gym at the time. And I was like, did that whole big classic, like, yeah, I didn't get it. My mom was like, oh, okay, well, that's okay. You know, we're still really proud of you. And then I told them, and then they like were crying.
Amazing. Yeah. I imagine that must have just been so wonderful, because we met right around that time, I believe. Might have been slightly before, because I remember thinking, what? This girl just got into med school.
Yeah, I think we met in third year.
Yeah.
That's when you and Roz were living together.
Yeah. So can you tell me about the process of like med school? Like, because there's an MCAT in there, which is wild. You got to go through interviews. Yeah. Can we talk about that process?
For sure. Like the process of getting in?
Yeah. So the process of applying, of the everything in between, and then getting in.
I blocked a lot of it out, you know?
Yeah.
So basically, I think it's in the fall, like September is when you start getting all your references. And so you had to have so many references, and that's always awkward, asking people, hey, will you write me a crazy long letter to hopefully help me get into med school? The MCAT, for sure, I wrote that like I think the summer before, while I was working a full-time job. So that was an awful summer.
Can you talk about that for people who are listening who's like, what's an MCAT? They've never even heard of it. Can you tell us about it?
So it's basically this test. It's a 7-hour test, and there's 4 categories. Gosh, if I can remember. There's like the physics section, for which I'd never taken a physics course. There's the cars section, I believe it's still called, which is basically your verbal reasoning and going through more of like the humanities and like critical thinking and stuff like that. There's biology, and then there's, I believe it's like psychiatry, maybe like behavioral sort of stuff mixed in there. But it's very, very broad. I think I literally studied for 4 months nonstop, like 5 or 6 hours a night with like lots and lots of practice tests. And even like the mental effort and the time aside, like it's a very, very expensive thing to write too, which is definitely a barrier for a lot of people with all the materials. And then a lot of people actually don't work while they're writing it because it takes so long to study for. So yeah, it's quite the thing.
Yeah. What was test day like for you?
Well, the day before so I wrote it in Ottawa. The day before, my mom and I just like went and like did some sightseeing in Ottawa and just like kicked it for the day to like de-stress. And then that day, I think I started at 7 a.m. Oh my gosh, I remember the physics section. Again, I've never taken physics, already not very good at it. I had to pee so bad, like the last hour of that section. It just did not feel like it went well at all. So I was like, I think I probably blew that one. Because you know when you really, really just have to pee and you just can't.
Yeah, you cannot focus on anything else. Yeah.
That was me. And then the rest of it I think was okay, but I was so happy to be done it. You know, just that like feeling of freedom, like when you walk out of like a burning building and you're like, I don't care if it all burns down behind me, I'm done.
Yeah. Nice. Cool. And then what? You write your MCAT?
And then, so that was like summers before I applied to med school, 2 summers before. But yeah, so you like upload all those results to the system, you get your references in order, pay your money, and then
the
you
most
just
important part, of course.
Yeah, exactly. You throw it into the void and you wait to hear back. And then like gradually starting around January is when the interviews come in. And you just get this random interview on a random day, or you get this like random email for an interview on a random day is what I was meaning to say.
Right.
And it just makes your world happy and bright or dark and cloudy.
In what way?
Like if you, like I remember when I got my Mac one, I was so excited because I really didn't expect to get one.
Mm-hmm.
I really didn't expect to get an interview. So I got it and I was like, oh my God, what the heck? Like you read it a couple times just to make sure.
Yeah. Is this real? Is this
yeah, exactly.
Okay. What was the interview like?
You know, again, like this all comes down to, I just really didn't expect to get in
Yeah.
3rd year. So like I did take it seriously, and I really, you know, I did a bit of prep before. But I think because I didn't expect to get in, I didn't really let my nerves get the best of me, because in my mind, it was almost like a practice for next year.
Right.
When like I have a better chance of getting in and I'm more likely to.
Yeah.
So I thought that was kind of like interesting. Yeah.
For sure it is. So are you consciously aware that because you had a mindset shift around this, that you then showed up calm and relaxed and as a result had a good interview? Yeah,
for sure.
And
I actually try and do that like now, like going forward, now that I realize that works for me, is I try, not that I half-ass things at all. Like I take important things seriously, I do. Yes. But I've also learned to sort of, you know, give myself a little bit of permission to relax and have fun with it, and, you know, just really like show your true colors, as corny as that sounds. Well,
I think it's so important because we all, like in our society, we become crippled by fear. Like fear of failure is huge. We're so afraid to try that we're so afraid to fail that we don't even try.
Yeah.
And we put so much pressure and emphasis on hitting a home run on our first swing ever. You know, I think it's really important to let that pressure off. And when we do, we actually end up paradoxically succeeding more.
For sure. For sure.
Cool. So how long's the interview?
It was like a half day. So like for MAC, the way they do it is you have, I believe it was 10 stations, about 10 minutes each. And you walk in and it's like a given scenario. They call it the MMI format. It's like a McMaster specific thing that I think some other schools are adopting as well. So like random stations with random questions.
And there's someone standing there talking to you?
Yeah, it's like kind of like an interview shaped around the prompt outside of the door. So it's like 2 minutes to read the prompt and then the bell rings and you go in and talk about it with the person.
Do you remember any questions, like anything that really stood out to you during the interview?
Yeah, I remember one that I thought I bombed.
Right.
The question was something like if you had $1 million donated to you and it was $10 million donated to you and you had to donate 90% of it to charity, which one would you do and why? So I walked in and like something that I had done a little bit of work in undergrad was like HIV in Ghana. And so for me, like that was something that, I'd said, that would be a cause that I'd like to contribute to or raise awareness for and set up some like local grassroots stuff. And I remember my interviewer kept on being like, okay, but how? Okay, but how? Like wanting the real nitty gritty details of exactly where you're going to funnel the money to help these people.
Right.
And at one point I just said to her, look, I'm a 21-year-old white girl. I have no idea what these people really, really need, like in their individual circumstances, in their towns. Like I can tell them what I think would be helpful, but who knows if it actually would be helpful. So I really don't know. I recognize that I have that privilege, but somebody does. And so you find the people who are actually affected and you ask them what they need and you work together. And that's how you create sustainable change, in my opinion. But like, I was fully like, look, I don't know. But I actually think like at the end of it, I thought I bombed it. But then like when I was talking to people after, they were like, you know what, maybe that wasn't the worst answer you could have given.
Yeah. It shows that you're humble enough to be like, I don't know, but we'll figure it out.
Yeah. Right? And you ask the people who it matters to.
Yeah, absolutely. That's very cool. Do you think if you had shown up super nervous that you would have had the confidence to answer in a way like that?
Could be. Yeah, like could be if you're so worried about what other people think of you and if you're not really being your true self, if you're trying to project an image of somebody who maybe has it all together or has all the answers, then yeah, I could see that for sure. I think kind of what I was just trying to get across is like, here I am.
Yeah. This message is so important. Almost every single client that I work with, this is something that is life-changing. If you can start to show up authentically you in the situations around you, everything changes.
For sure. Because you start expecting more, even like of other people, about what you want. You're not just trying to make other people happy.
Yeah.
Trying to make other people happy for sure, but also by being true to yourself.
Yeah. Do you have any strategies or methodologies that you've found work for you in facilitating that?
I think for me, I'm a very like thoughtful person. I'm a very reflective person. And so I always try to, if I'm like feeling a little bit anxious, I always try to get to the bottom of why I'm feeling anxious and either like accept it or see if there's anything I can do to change it. And if not, then I accept it. And then knowing that I've accepted it or I've changed it or whatever, then I can be at peace with it. And so in general, I just try and be at peace with what I do. Yeah, I don't know if that really answers your question, but in general, I think that you just have to be kind to yourself and you have to give yourself forgiveness if things don't always go your way. Kind of have to just honestly laugh at everything and have fun with it. Yeah. Not everything you can laugh at, but I think you can have fun with a lot of things.
Yeah. Life's just a big game. Sometimes taking ourselves less seriously makes it just a lot more fun.
I think that's what I was trying to say really, is just like, I don't try to take myself too seriously usually.
Yeah. Awesome. I think that's such an important topic. And I really encourage the listener to this. If this is something that you struggle with, go back, rewind the last few minutes and listen to it again, because if you can do this, a lot will change for you.
Yeah, I think we put a lot of pressure on ourselves. Like we all do, no matter what we're trying to achieve. And, I think a lot of the time, if you stay the course, you put the work in, you're going to get there usually. But you have to like who you are when you get there.
Yeah, that's an incredible point. What if you lose yourself along the way, right?
Yeah.
Did that ever worry you? Did that ever come up for you?
All the time. I mean, honestly, it still comes up. Like medicine is a very difficult career. There's just so like you're there for the worst day of people's lives every day. And internal medicine, in particular, you just really see a lot of like sad, debilitated people, just like one after the other, over and over. And everybody is going through some kind of crisis, and loss of empathy is actually a huge issue in medicine. It's a huge issue for patients, for each other, because you're just so like overloaded with all this crap in the world. And so something that, I've always been on top of myself for is, like trying to like stay the person that I wanted to always be in medicine. I came in, like I said, because I love the science, but I also love helping people and I love being there for people. And I think if you lose that, then you've lost half of your reason for being in the career.
Yeah. So how do you do that? Like, how do you prevent that from happening?
It's a good question. And I'm still trying to figure out the best answer, to be honest. But what I have been doing is I think you can't take really well care of other people if you don't take good care of yourself. So, back to giving yourself forgiveness, giving yourself permission to not take yourself too seriously. I think like I can be pretty in tune with myself and I can recognize like, Kristin, you're really tired, you're really stressed, you need to take a break. And so, sometimes, I shut my phone off to most people. I'm bad at responding to texts and I kick it for the night. I just take it easy. And I think a lot of reflection has to go into that as well. If I find myself rushing through a patient interaction because I have 7 other people to see before 11 in the morning, I think I just try to be mindful of that and just reground yourself. And you don't have to be perfect. That's not to say that you never have those moments where you kind of like lose a little sight of what's important, but just that you always bring yourself back.
Yeah, I think that actually I want to extend the question to you. What do you think would happen to healthcare if that was a regular practice for every healthcare practitioner?
That's a good question. I have to give a lot of people credit. I think in residency, it's definitely easy to sort of lose sight of, but I've had a lot of really, really great teachers, like who are staff, and I feel like you get a little bit of your wellness back when you're a staff and you have a bit more time and a bit more of a life and you start to remember what's important again a little bit more. But I'd say that being around me, like I think usually we do a good job of grounding each other and reminding each other of what's important.
Nice.
So I'd say that for the most part, the majority of people are really in medicine are really introspective and really reflective, and we all make that effort. But I think we all have, our hard days. And I think there's definitely people who are burnt out. Like burnout is a huge, huge problem in medicine. Honestly, I'm a little burnt out right now, but you got to bring yourself back to it, back to what's important and take care of yourself. And not to say that I'm totally burnt out, but I just feel that I'm tired.
Yeah.
And I'm aware of that.
Yeah. The awareness is so important. I think we often go through life and just search for distractions to pull us away from that awareness because sometimes it's really uncomfortable, right?
Yeah.
But so important. Okay, so you get into med school. Huge hurrah, huge life-changing moment, huge celebration. Can you tell me what it was like, what med school was like?
I loved med school. Med school was like the best 3 years of my life. It really was. I had such a great group of friends. I miss them so much right now. Yeah, I really loved it. It was great learning. I loved McMaster as a program. It was really fun. And there was hard times for sure, to put into framework, like med school, when you start, you have your first couple of years, which is like you're just really a student in lectures and learning. And then your last couple of years is like actually working in the hospital and rounding on people. So the first couple of years is, honestly, I worked not as hard as I did in undergrad. Like it was great. We had a lot of fun. Yeah. And the second, like the last couple of years is basically what I'm just doing now, but I'm a little bit more experienced. I get paid for it now. So, yeah.
So more specifically, like what is a day in med school like?
So like for like the first half of it, like we talked about, would be going to lectures, learning your clinical skills, learning how to do exams, getting your stethoscope and figuring out what it does. Yeah. And then the second part would be like, for example, what I do now, like you show up to the ward at 8 a.m, you meet with your team, you split the list of patients. As a med student, you might get like a couple and you go see them, see how they're doing, think about what tests you need to order or medications to tweak on the person. And then you meet with your team again and round.
Right. So was the first few years of med school very similar to undergrad, but more relaxed? Like, it's classroom setting, we're learning stuff.
Yeah, I'd say so. Like, I think a lot of people think like, oh, med school's got to be so difficult. And like, it is, but I'd say it was more the clinical part of it that I personally found difficult, just because of more of the workload, just because you're working like the same hours that I'm working now, which can be as much as like 90 hours a week. But like the first part of it was, yeah, you have to learn your stuff and you want to learn it because it's interesting. But like, all the extra stuff you have to do in undergrad, all the papers, you don't have to worry about grades when you're in med school. Like it's nice.
Yeah. That's interesting.
At least I'm in master, we didn't worry about grades.
Yeah. So it's like once you're in, assuming that you do your work.
And you know what you're doing. Like you still have evaluations to make sure that you're competent and you're not just like slacking off, but like you're an adult learner basically. Like there's a certain level of responsibility. Right.
Okay. What was it like going into a hospital as someone who is going to be performing medicine?
I remember like being surreal initially. Like it's a huge privilege. It really is. Like I think it's almost like a different culture. So it's almost like culture shock, to be honest. I remember being like so surprised to see people in such a vulnerable state, and like they look at you for the answers and you don't always have them. And I remember that being like a really uncomfortable thing to get used to, just like seeing people in these states and wanting to help them. Yeah, because
at least, again, just speaking from North America and not as a doctor, I think a large part of our society views doctors as like oracles of health. It's like, you must have the answer. What do you mean you don't have the answer, right?
For sure. Yeah, it can be a little bit like, I don't even know. Shocking. I guess it's just shocking really to see so many people. And like, I think the big thing for me was just like, as a doctor or a med student at that point, you have access to all this private information about people that you would like, for example, you'd meet somebody random, right? And yeah, you might have a great conversation with them, but they're not telling you that they smoke marijuana like every day of their life, that they have other drug use problems, that they think they might be pregnant, but they're not sure and they're really scared, or they're having diarrhea or something like that. Like you get really just in the intimate details of people's lives, and you're in that position where you're expected to help them and do something about them, and you want to. And it's very, I remember just being like very different from like your normal interactions with other people.
Yeah, absolutely. How close does Grey's Anatomy come to real life medicine?
My God. Okay, so I love Grey's Anatomy. I always loved Grey's Anatomy. So bad though. So bad. Like I would watch it in med school being like, this is trash, but I love it. And this is what I need right now to relax.
Yeah.
There's lots of things that we can talk about. Basically, every single person would be in jail with no medical license in the real world. And not just for like the borderline stuff that they're really dramatic. They're like, oh, like, I don't care what the system says in America. I'm going to pay for their drugs, or I'm going to cheat like the system for them. Like, yeah, that's obviously illegal. But even the stuff where they're like telling people about patients' information, like they just breach confidentiality so much. Yeah. And it's so illegal and it's so bad. And then the other thing, I won't go on too much of a rant here, but the other huge thing is when you see somebody die and they do CPR in Grey's Anatomy, the person will be down for like 20 minutes, like more, and they do CPR on them. And then suddenly the next minute they're talking, they're totally back to normal. And that's just not what it looks like.
What does it look like?
Like codes, I have been to, I think like three like classic CPR, everything codes. Not one of them has lived.
Yeah. What's that like for you?
Awful. It was awful. Like I remember my first one was, it was in July. So when I just started residency, it was my first rotation was cardiology. And, you know, it was like 2 a.m. and I was so tired. And I got called about this guy on the ward who had chest pain. And so I went down and he just like didn't look good. He just looked like clammy. He was like clutching his chest. The nurse was like, yeah, like, I'm not sure if he had a seizure not so long ago. Like, that's why I called you. He just kind of went unresponsive. And I was like, whoa. Like, I'm out of my depth here. And so I looked at the ECG, which is like that thing that they put the probes on for you and it shows you the electricity of the heart. And it was all over the place. Like this guy was in a ventricular fibrillation rhythm, which is big bad news.
Yeah, that's no bueno.
Yeah, no bueno. So I called like my senior right away. He called the fellow right away. Like we came down, we were like sending tests off. We got the guy into a more monitored setting, but like within 5 minutes, like a code was like, he was unresponsive, his heart stopped. The code was called, we were doing CPR, but it didn't work. And this guy was like 59 years old. At 30 minutes, you know, we all made the decision together to step away and to stop CPR. And I called the family. And it was like one of the worst conversations I've ever had with another person. Because there's no good way to say it, especially over the phone. I mean, again, I don't want to go on too much of a rant here, but
this is important. But
because of the current like COVID situation, as I'm sure many people know, you can't really visit your loved ones in the hospital. Usually, like I think at Kingston, there's one person allowed every other day, but it can only be the same person. So, you know, it doesn't matter how many loved ones you have, and if one of them wants to come in a different day, it can only be one person, like one designated person every 2 days. And so, like, this guy was alone, like, except for us when he died. I mean, it was also in the middle of the night, but, like, his family wasn't there. It really hurt me thinking that, like, his family had no idea that anything was wrong until I called them. And I was like, hey, I'm so sorry to be the one to tell you this, but like your father had a cardiac arrest and we're trying CPR, but it hasn't been successful. Yeah. We're gonna stop.
Yeah. Was this the first death that you had experienced? Like
no.
Immediate death?
Not the first death. But I think it's one of the ones that hit me the most because I saw them when they were starting to circle the drain. Right. You know, like I was the first one called when things were starting to go wrong for this guy. And you can't help but think like, is there something that I could have done sooner? Is there like, should I have called my senior like on the way down? And I don't think that I needed to do that. I don't think it would have made a difference. But I think that one was especially difficult for me because I wasn't just like a learning observer watching something awful happen to somebody like I had before. I was directly involved.
Yeah. What was it like for you to give that phone call?
It was
Can you
awful.
walk me through like what was going on internally for you?
I had no idea where to start, honestly. Like, yeah,
So,
I think started
do they
guilt.
not prep you in
No,
med school?
yeah, no, they do. Like, they give you the classic how to deliver bad news framework, and I think for the most part that works usually pretty good in like a setting that's not super acute. You know, like if you have to tell somebody they have cancer, you like have this whole like framework where you make sure they're in a secure setting. You try to get an understanding of what they know about the situation. You sort of meet in the middle, communicate the information, formulate a plan and everything. But, you know, it didn't work that well in this situation, honestly, because we're in the middle of basically CPR that we're getting ready to stop. He's dead. There's nothing to do. Yeah. So I don't think there's much that can prepare you to give that news and certainly not to receive it.
Yeah. How has becoming a doctor impacted your relationship with life and death?
I think like a lot of us, and me before too, like you think of death as like the saddest thing that can ever happen, and you know, the worst thing and it's awful and life-changing, of course, it always will be. But I think what I've learned is that there really are worse things than death. And I think that death, while always sad, isn't always traumatic and isn't always a bad thing. I've seen a lot of beautiful deaths. I'm on palliative care actually right now is my current rotation, and I think there's something to be said for giving somebody a good ending. I think that's just as important as in the story as the middle and as the start. Mm-hmm. You know, I think when the end of somebody's life is approached with the right mindset, and granted, this is in cases where you have time to think through all this and it's not sudden and it's not traumatic, but in this situation where you have time, I think the end of life can be a really special time for people, and it's not always bad. Sometimes it's just a beautiful ending to a beautiful story.
Nice. That's awesome. Yeah, very poetic. What is the biggest lesson that you've learned throughout your journey thus far?
Oh gosh, I don't even know. And
so maybe to make it a little easier, what is one of the big lessons that you've learned?
I'd say that, honestly, the big overall theme that I've learned is that life is very unpredictable, and it can be short, it can be very long, and there's not really much way to know which one it's going to be. Everybody has some problem of some sort that they don't tell most people in their lives. But I think overall what I've learned is to be so thankful for my health, for my family's health, and just so grateful that it is that way. Because like I said, and I'm not trying to sound, you know, dramatic or important or anything like that, but like I do see a lot of sad stuff, and I see a lot of sad stuff happen to a lot of good people and people's families. And so I think what I take home every day is just honestly how grateful I am for my health and for my family's health, understanding that that can change, and that if it does change, it's okay and we'll get through it. But right now, things are good.
Such an important message. Such an important lesson. What advice would you give to someone who's on their own climb right now, some journey of their own that maybe is feeling a little impossible? What would you tell them?
I tell them that, you know, not everything boils down to hard work and perseverance, but I think a lot does. And I think that usually if you work hard, if you stay the course, you stay well, you take care of yourself while you're doing that, then you can be pretty unstoppable, and you can usually get to where you want to go.
Nice. My next question is not for you, Kristin, but for our listeners. What would happen to your life if you applied that starting today? If from this day forward you applied that lesson to your life, what would change for you? Kristin, is there anything else that you want to say? Is there anything else that you want to add in here?
Thank you very much for having me on your podcast, Jordan. I've never done one before. So I hope I
first
didn't
time for
ramble
everything.
too much, but I had a lot of
it's
fun.
Wonderful. Yeah, fantastic. Me too. So for anyone listening, if you'd like to reach out to Kristin, her email is in the description. If you found this podcast beneficial, please consider subscribing and sharing this episode with someone you know so that they can benefit from it too. Every episode is absolutely packed with so many golden nuggets of wisdom. You never know what someone needs to hear. See you next week with another episode.